It's up to us to make sure that the medical team we have is managing our disease the way it should. And it's up to us to make sure our health insurance is paying them to get the best advice we can get. Are my doctors, hospitals, and pharmacies in network, or will I need to pay extra? Do I need to see a generalist for diabetes care?
When you get your insurance, they give you a portal or a login, and what you can do is if you need to find a new provider that's in your network, you can go into their covered providers and find a new one.
My parents have been very open with me about health insurance and how the health insurances work, and they encourage me, well, just give them a call, be really nice to them on the phone and ask them all your questions and let us know what they say and everything, and we can go from there.
Primary care doctors are great, but they don't really know the whole ins and outs of type 1 diabetes management. So if you can and your insurance will cover it, go and see a specialist. Go to a diabetes clinic.
So when you're looking at different insurances, they lay out basically what you are qualified for. With each plan, you can see the drug list. So when it comes to being diabetic and looking into the different insulins that they cover, some insulins are covered at a different tier. So specifically diabetes, what I found was difficult to kind of navigate was the difference between what fell under prescription and what fell under durable medical equipment. If they've covered durable medical equipment at 100%, but maybe prescriptions cover about 50% of it.
There are a number of lower cost alternatives about prescriptions. I have seen mail orders be more expensive than picking it up every month at a discount pharmacy. And many times they get a better price than the local Walgreens drugstore. For example, my own personal plan has got CVS Caremark as the PBM, so they try to push me to CVS. When I checked, it was no more expensive at grocery store pharmacy than it was going to CVS, where I've got a CVS card and they try to push me there.
As far as pump supplies go, you cannot get that in a normal pharmacy. That has to be mail-in order. And mail-in order is usually just really easy. You just call once a month, or you can even just text or chat online. They make it really user-friendly.
There are different people for different things that you have to go to. So for my durable medical equipment, my devices, I had to call the supplier that was covered under DME. But for my prescriptions, I had to call a pharmacy.
I was on Humalog for my whole childhood because I was diagnosed when I was 9 years old. And then when I turned 18, 19, then I had to switch over to Novolog because my health insurance, they couldn't cover Humalog anymore. I think we did get a letter in the mail saying that we had to change over. And so that's when we were like, okay, well, we gotta go to my doctor and see what could I get on that similar to Humalog.
I was like, I can't be the only one asking these questions. I'm not sure what the runaround is, but it turned into hours on the phone, and it was exhausting. So what I ended up doing was able to ask family with the same plan, what do they cover for you?
I was nervous to call them too, and I called them and I was like, okay, let me see what they say. And they turned out to be really nice people.
We've all kind of banged our head against the wall because we don't exactly get what we have to get. So, stay calm. It'll be okay. Everybody's continually learning, but you're not alone in it.